Welcome back to Wichita's Biz That Is, and we're honored today. We have Brian Powrs, who is the head of Home Healthcare Connection, has a very interesting career, and is also the chairman of the board of the Wichita Independent Business Association. Brian, what in the home healthcare business, what changed over the last 10 years? What's different from back then?
Well, it started with the Balanced Budget Act, and it's budget-driven changes to the Medicare system. It's the largest entitlement system we have in the country, and projections are that the fund would be insolvent by 2016 or 2020 or 2030, depending on which actuaries you listen to. But it's a big system, and back in 1997, Congress passed an act that would curtail those expenses and help provide solvency to the fund for a longer period of time. The fund itself didn't change, and all that changed was rules. From 4 sentences in the Balanced Budget Act came hundreds of pages of new regulations from Health and Human Services, under which a home health or hospice agency, or long-term care for that matter, needed to operate in order to be paid for their services through that mechanism. It started with that. We've seen several iterations of similar budget problems or changes to the system. We went through different payment systems, interim payment system, prospective payment systems, an acronym soup of systems, basically, IPS, PPS, BBS. And with each iteration came more regulations. The last act, which is, I guess, the grand finale, would be the Affordable Care Act. And that will add millions of pages of regulations to an industry that is already inundated with regulations, to the point where regulations conflict with one another. And really, what's the point of the business? What's the point of the industry? It's to take care of people. And it's become more about taking care of auditors and surveyors and making sure that the paperwork is completed correctly. I hope that we never lose sight of the patients and the care that should be provided under those programs. I would clarify something. I'm no longer the owner of Home Healthcare Connection.
Yeah, right. I tried to say that. I may not have said it correctly.
And that's fine. And currently, I'm the CEO of Powrs LLC, which owns the real estate that was involved in all those companies.
Okay. I know, for example, the people side of that business is complex. How many different background checks would you have to do on somebody who's actually providing those services in the home?
Well, since your last question dealt from an historical perspective, we'll start back in 1996 when I started. The background check provision was barely there. Of course, professionally licensed nurses and therapists and others had a background check through the KBI, the FBI, because they handled pharmaceuticals and confidential data, things of those nature. But the home health aides, the certified personnel, there was no provision. I spoke in support of a bill at the time that would implement a new background check provision for all healthcare workers to help improve the industry, to help improve the safety for all our patients. So then there was one, at least one. Now it could be dozens, because every agency that a person has worked for, or every agency that audits a home health care company or hospice or hospital or nursing home, they all have their own background check provisions.
Well,
they don't share a database.
Give us a couple of examples of who is doing this auditing. And
well, let's start with the state of Kansas. There's occupational credentialing, and Kansas Department of Health and Environment. And through them, one would obtain their Kansas Bureau of Investigation records. Through them, they would receive any national records if a nurse or another healthcare professional came from another state. The more a person's been involved in the industry, the more background checks there are. Up to and including now, Homeland Security with our recent concerns of terrorism and others, who knows what is to come. It's one more, and with the E-Verify system, another background check.
E-Verify is a system which the feds have put in place to find out whether a person is a legal resident of the country.
And that's a good thing.
But it's one more on top of
exactly.
the others.
It doesn't supplant any previous. It only adds to a very complex system of compliance.
Yeah, I think what bothers me is when you look at these things and they try to give people more what sounds like good options, etc. You do things like saying, well, we're going to limit the doctors on how much they can make. It doesn't really work because the doctors can say, I'm not going to do that.
And they do.
And they do. They have in a lot of cases in Medicaid.
Yes.
Over half have left it. We're going to be back in just a moment with some more time with Brian Powrs on Wichita's Biz That Is.